Namibia is a huge country with a population of 2.3 million. They have fewer than a handful of anaesthetists, and many of them haven't completed enough training to safely treat people.
Cardiff University have a range of engagement projects. They want to bring people to the university and the university to people. And the Vice-Chancellor asked me to develop a project in line with Welsh Government's Wales for Africa international development agenda. He gave me a blank sheet of paper and said, "Judith, how can we best help?" And so after a lot of discussions and thinking about the problem with staff and looking for partners, I developed an education project between Cardiff University and the University of Namibia in Namibia.
And so when you got there, paint a picture of what it was like, the conditions that you were working in.
So Namibia itself is a country with huge extremes. It's got extreme poverty and some very, very wealthy people. The people who are in poverty really struggle with health and to get themselves out into a better life. So our project is really focused on poverty reduction and health promotion for the people in need in Namibia. If you live in Windhoek, you could be in Cardiff. It's a wealthy capital city. If you go into the rural areas, people live in mud houses, in kraals, without sanitation, without water. People are dying on their way to hospital because they can't get good anaesthesia care. They have to travel enormous distances to get to somebody who will be able to give them an anaesthetic so they can have their operation in an emergency. And on the way, if you have to travel 48 hours, 2 days to get to a hospital, things will go wrong and lives will be lost.
Women are 17 times more likely to die in childbirth in Namibia than in Wales. Dr. Brian Jenkins accompanied Professor Hall in the trip. He tells us how vital it was.
Well, we get a lot of feedback from participants that they felt much more confident in giving anaesthetics after they had the training. In one case, we helped a trainee with simulation training in the morning, and she actually performed a similar sort of procedure on a patient in the afternoon. And she later came back to actually say how much she thought the training had helped with in the morning. So I think there's an example of direct patient benefit within a very short period of time. A lot of the trainees didn't know how to check an anaesthetic machine, for instance, even though this would be something that would be taught in the first week of any new trainee within the UK. So basic checking procedures and basic safety, I hope, will be a legacy for the practice within Namibia for those trainees.
It's part of Cardiff University's Phoenix project. It's a response to the Welsh Government's Wales for Africa programme, which works to eliminate poverty in Africa by 2030, in line with the UN Sustainable Development Goals.